else's painkiller to get high? If you answered yes to any of these questions, you've misused or abused prescription drugs. And if you mix these medications with alcohol or other drugs, you increase your risk of addiction, overdose, and even death. You need to think twice before you take someone else's prescription meds, and never share your meds with others.
A message from the San Juan County Partnership, 505-566-5867.
A new topic, local favorites, will be featured every other Wednesday on Roving with the Arts with me, your host, Mick Hess. I'll be talking with local classical, jazz, and folk musicians about their favorite styles of music and hear musical excerpts that are some of their favorites. We'll even find out what kind of music they would want to hear if they were stranded on a Pacific island. Join me for some interesting and entertaining musical insights of some of your favorite local musicians.
KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them, whether it's a stroke, heart attack, illness, or injury. San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. Ten minutes past 8 o'clock. It's Wednesday morning, March 10th, 2021. Good morning, everybody. I'm Scott Michlin, and thanks for tuning in to KSJE 90.9 FM right here in San Juan County, New Mexico, 103.3 FM over the air in Durango, Colorado, and streaming everywhere on Earth from our website at ksje.com. This is also a visual radio station. Thank you for joining us, watching the visual radio video stream, going live to the KSJE Facebook page, our YouTube channel, and our Twitter account. Glad that you are with us, everyone. Thanks for being here. Coming up this morning, we are talking about urgent care and COVID-19. Dr. Sugar Singleton is my guest this morning from San Juan Health Partners Urgent Care. Also, Monica Nagahiro, the manager at San Juan Health Partners Urgent Care. We'll be talking with them about some important situations and how they are keeping COVID patients separate from their urgent care patients, coming up in the next few moments right here on KSJE. And then, of course, we'll check in with Dr. Mike Hadabaugh with the Encouragement Lab. This week, Dr. Hadabaugh is talking about sledgehammers, of all things. He will explain when we talk with him later on this hour at 8:50 a.m. on KSJE. Mick Hess will join us next, Roving with the Arts, of course, taking over the studio space here at the radio station. At 9:06 a.m., Mick is featuring music from Felix Mendelssohn on the program today, a 90-minute version of Roving with the Arts, which will take us to 10:30, and our local and regional author program, Right on Four Corners. Tracy Hales-Vass is speaking with author Elva Osterreich about her latest book about New Mexico and the Manhattan Project Trinity Test, witnessing the bomb in New Mexico. We'll be talking with author Elva Osterreich about her book coming up this morning at 10:30 on KSJE. Of course, we invite you to connect with us on our social media platforms, including Facebook, YouTube, Twitter, and even Instagram as well. And we always tell you that visual radio can take you places. Let's head up to Michigan. This is the Detroit River outside of Detroit, Michigan, of course. Some ice flowing by in the Detroit River, at the border between the United States and Canada, of course. Right now, it is a warm 50 degrees in Detroit this morning. Cloudy skies, as you can see, on their way to a high today of about 66 degrees in Detroit, and an overnight low of 50 degrees. Here at home, it is 38 degrees outside our studios here at San Juan College. We are expecting a partly sunny day today, but some increasing clouds later on in the day. 50 degrees for a high today in Farmington. Those increasing clouds bring with it a chance of some overnight snow showers tonight with a low of 29. Chance of more snow showers on Thursday and Friday and Saturday and even on Sunday. Overnight lows tomorrow, 31 after a high of 51 on Thursday, 52 for a high Friday, 44 on Saturday, and 51 on Sunday, but chances for moisture for the next several days. Joining me this morning to talk about urgent care from San Juan Health Partners Urgent Care, physician Dr. Sugar Singleton is back at KSJE. Good morning, and thank you for coming back in to see me.
Good morning, Scott. Thanks for having me again.
You
It's
bet.
always a pleasure.
Good to have you here. Also, Monica Nagahiro, who is the manager at San Juan Health Partners Urgent Care, is here as well. Good morning to you.
Good morning, Scott.
Thank you both for being here to talk a little bit about urgent care and this whole time when folks are trying to think about what's urgent, what's not urgent, and all the different things. And of course, we have COVID on top of everything. And so you all have been taking, I know, a lot of precautions with COVID, but still open for folks to come who have an urgent medical need. So Dr. Singleton, let's start with you by talking a little bit about what you're seeing these days. Folks are still coming to urgent care, right? They need to.
Absolutely. Yes, Scott, we've been open the entire pandemic. We've not had a single day of closure. Also, one thing I want to emphasize that we're very proud of is we have not had a single outbreak of COVID in our urgent care. All of our staff has remained safe due to our safety protocols and all the new changes that we made. As soon as this pandemic kind of went into full force, we jumped right in. Monica was very big advocate for a lot of changes that we made. We haven't had a single outbreak at urgent care, and we're very proud of that. So
that is something to be
very
proud of.
safe.
Yeah.
Very safe for people to come. And if you have been putting off care, don't put off care anymore. Get in to see your regular doctor. Come and see us. We're open. We're ready to take care of you, and we're going to do it in a safe manner.
Good point. And I should point out, too, I think that you have certainly seen COVID-positive patients at
we're
urgent
seeing-
care, but
absolutely.
because of your precautions, it hasn't spread or gotten any further than it has, right?
Exactly, Scott. Yes, we're seeing COVID patients every single day. We instituted a respiratory clinic outside, actually, very early on in the pandemic, and we have maintained that throughout this entire year. We're seeing anybody that has any kind of respiratory complaints, fever, chills, body aches, headaches, of course, cough, shortness of breath, sore throat, those type of things. Those folks stay in their car. They are visited in their car by a triage nurse and then by a physician, and we do all of their care in their car so that they're safe. We're in full PPE taking care of them. That keeps us safe. And then it also keeps everybody inside the clinic safe and separated from those patients who may have COVID. But yes, we have seen COVID patients every day throughout the pandemic.
Right. And Monica Nagahiro, let me turn to you and ask you again a little bit about those changes that you put into place at the beginning of this pandemic, which is now almost a year old, as we all take a deep breath, because when we were talking before we came on the air this morning, that none of us thought this would be going on 12 months later, but here we are. But some of the changes to have that separate outside, separate facility in order to intake some of those patients who may or may not be COVID positive?
Absolutely. I think the physicians and our mid-levels at urgent care were instrumental at really building a process. The nurses and the MAs and the CSRs, the entire team got together and we kind of just rallied together and figured out how can we safely and effectively take care of our patients in an outdoor facility. And the process kind of just grew organically, and we were able to maintain that outside. And then, two, we were able to reassure our community that if you came inside, that we were going to protect you the best way we knew how.
And you have.
And we have. And we had a couple of patients actually compliment our process, and they felt safe coming inside. They were able to get their lacerations fixed, get medications refilled, chest pains, UTIs, anything. We were able to see them inside and treat them without any fear of any kind of cross-contamination or an infection process going on. So it was really an organically grown, and the team has been amazing. They've bought in quickly, and they've just jumped in wholeheartedly and embraced this entire process, and I couldn't be more proud.
Great to hear. Well, congratulations. And again, all of this, I think a lot of people were kind of reinventing their policies and procedures as we learn more and more about the virus, because very early on we didn't have a lot of information, and so a lot of folks were still trying to kind of figure this out as we move forward, and that's still happening in some cases. Again, the whole idea behind having urgent care is to try to take the stress off of the hospital's emergency department, right? And so when folks have an urgent need, they can come to urgent care instead of bogging down things over at the emergency department, right? Because they're still seeing lots of different things going on, from accidents and other folks walking through their door.
Sure. Of course, all the ambulances go to the ER. And then if you're having any kind of a serious medical condition, chest pain, of course, if you think you're having a stroke, any symptoms of stroke, severe abdominal pain, severe headache that could be a stroke or something significant going on in your head, of course, those are things that it's better to bypass urgent care and go straight to the ER. Those are emergent processes.
Right.
But pretty much everything else, Scott, we're up and running, and we handle high acuity stuff. But like Monica mentioned, any kind of a urinary tract infection, lacerations that need to be repaired, you cut your hand on a knife and need to get that sewn up. Broken bones, we take care of all of that, get people splinted and get them moving right along. And then any other kind of sore throats, runny noses, colds, coughs, etc.
Gotcha. And so that part really hasn't changed all that much, right, over the last 12 months. People are still falling out of trees or falling off a bike or whatever the case may be coming to see you if their doctor's office is closed or what have you, right?
Correct. Yeah, nothing really has changed to urgent care other than we have this second tract or second clinic that's running outside, and that's in order to keep people safe and keep any COVID possible patients away from the patients that we were just referring to, and keep everybody safe and still maintain good care of everybody.
Right. And a lot of it you mentioned too, as you make first contact with folks maybe in their cars or then bring them inside or determine what track they need to go on. That's kind of the newest type of intake, I suppose.
Exactly, yes. They can come in through the front door very quickly. They're asked some screening questions, either in person at the door, or a lot of times it's done by phone when they first call. The screening questions are done, and it's determined whether or not they should be seen in their car or if they can come in and be seen by a doctor inside.
Got you. One of the things, too, I wanted to ask you both about is the San Juan Health Partners Urgent Care. You are very proud of the fact that you always have a physician on site while the urgent care is open, and that's something of a significant thing, right, for folks to understand.
Correct. And do you want to talk a little bit
Monica,
about
do you
that,
want
Monica?
to take that one?
Sure. I think it's important to know that we are staffed with physicians 24/7. We have a physician on staff every day, and they're ready and willing and able to see there. They're great support for our mid-levels. We do have nurse practitioners and physician assistants available as well to treat our patients. But the knowledge behind our physician leadership that we have at urgent care is hands down one of the most important things that you could have, and it's a very rare thing. I don't think a lot of urgent cares or a lot of facilities realize the importance of having a medical physician on staff all the time to answer those hard questions or make hard decisions, and they went to school for a reason.
Right.
I
And
think there was some community concern. There has been community concern.
you've heard it, yeah.
Yeah, we've heard a lot of complaints and concerns about some urgent cares who are staffed only with mid-level providers, nurse practitioners, etc. And we do utilize them, and they are great for support. But as Monica mentioned, they didn't go to school for 11 years to get those two initials behind their names. And while many of them have great experience, we place an emphasis and a lot of value on the fact that we always have a medical doctor in the San Juan Health Partners Urgent Care at all times. And so if people feel more comfortable seeing a medical doctor, they can ask for it, request it anytime. Or if they do end up seeing a nurse practitioner but they want a second opinion from the doctor, we're always there for backup. We're always there to maintain excellent care.
And I think that's significant because, again, if someone's coming in and they've had some type of urgent medical need, they're already a little stressed and already wanting the best care that they can get. And so to know that someone like yourself, Dr. Singleton, is available, even if you're not seeing that patient directly, but maybe they had another question or what have you, or a second opinion, as you mentioned, you're just down the hall and they can get that message to you, or the nurse practitioner can run down and say, would you mind coming in and taking a look and letting me know what you think about this case, right? Is that how it works?
Exactly, yes.
Everybody's seen too many TV shows.
No, that's exactly right.
Is that how it works? Good to know. But I think that's significant, and so it's good to be able to know. Let me ask you both about COVID and the pandemic. We were talking about vaccinations, of course, and they are rolling out now throughout our state. I think our state has been tallied as one of the best in the country for getting shots in the arms of folks from the doses that we get. And your advice from both of you, I think, is if your name comes up and you get a call or get a text to make an appointment, you should not let that go to waste. You should make that appointment and get the shot in your arm if that's something that you want to do for your health, right?
Absolutely. I got my shot the second day that they were in the community, and I was so grateful for that opportunity, Scott. I didn't have any side effects personally. I think there's some stuff going around on social media about side effects and whatnot, and I do think that they're minimal from what I've seen. I personally had a bit of a sore arm, and my second vaccine I had a little bit of chills, but nothing of any significance. And even if somebody does end up getting a few side effects, I mean, the benefits so far outweigh those minor challenges that you might have for a day or so. But yeah, get the vaccine as soon as your text message comes across from the state that it's your turn. Don't put it off. Don't think that maybe there's somebody more important or less healthy than you are. Don't try to be a saint. It's most important for us to get herd immunity, most important for all of us to get vaccinated. And as you said, the state of New Mexico has done a fantastic job just rolling out this vaccine and getting those shots in the arms. I'm very proud to be in New Mexico, and I'm super grateful that I've had my vaccine.
It's really been great. I think we're maybe at 90% or something of the doses that we get. That's the amount that's going into the arms of folks on a regular basis. Monica Nagahiro, same question. I know you've been vaccinated as well, and I imagine you would agree with Dr. Singleton.
I absolutely agree. I had my vaccination about the same time as soon as it came out, and they allowed healthcare providers to go into the hospital and receive that gift. I was there. We encourage all of our healthcare providers on the front lines to get that. And I think the most important thing to remember is not to put it off, not to try to decide which type to get. The most important thing is to go out there and get it, because right now the studies are saying that it's keeping people out of the hospital. It's keeping you from experiencing a major medical event. You might get sick, you might get COVID, yes. I mean, there's always a chance. It's not 100% proof, but it will definitely probably keep you out of the hospital and keep you from being very ill.
Right. And the difference between a mild case of COVID and a serious case of COVID, I imagine both of you have seen patients that have suffered from both of those. And so the problem that at least I see as an outside non-medical guy looking in is that you don't know what your body might react. And so you may get a mild case, and that'd be wonderful, but you may be one of the more unlucky ones that gets a more serious case, and you end up hospitalized on a respirator. We hope not.
Exactly.
I think another important thing to remember too is the side effects from the vaccination are very mild. You might have a headache, you might feel a little bit tired, things like that, but it is nothing near what COVID can do to you in the long term. We're seeing a lot of our patients returning with high heart rates or ongoing headaches, ongoing malaise, and they're not doing okay. I'd rather have the vaccination and have 24 hours of uncomfortableness versus a lifetime of not knowing.
A lot of long-term effects that we're hearing about, not in everyone, again, but in some people. And again, the thing is, you don't know if you're going to be one of those folks, the long haulers, as I say, that will suffer from some of these effects for a long time, forever perhaps, who knows. And it's affecting all ages too, as I understand, right? Some younger people having some of these things as well. So it is still a big concern as we hopefully get everyone vaccinated and get herd immunity and start to get back into some form of normalcy as we can gather with everybody and be more of those community events that we all miss and enjoy so much. One of the things I wanted to ask you both about while you were here is testing about COVID, because again, that's been a big part of this too, is to find out who has it, who's not feeling well, or who maybe has it and has no symptoms, which is another strange part of this virus. You're offering rapid testing now at urgent care, correct?
Yes, we do have the rapid testing available. We're very excited about that. We're getting our results back in 24 hours usually, very accurate testing. So anybody that needs to be tested, wants to be tested, especially if you're having symptoms, you've been exposed, those kind of things, come on in. We're absolutely happy to take care of you. There is still a bit of concern, I guess, about whether or not asymptomatic patients need to be tested or not, but we're kind of resolving those questions as they come up. But right now, if you feel like you need to be tested, if you've had any kind of an exposure, if you're having any kind of symptoms, fever, chills, body aches, headaches, certainly the big ones that we've seen evolve over the course of the last year, the loss of taste and smell, those are big ones that definitely point to COVID. Cough, shortness of breath, sore throat. Get in to see us. We'll take care of you in the respiratory clinic, and if it looks like you need to have a COVID test, we're doing them now, and we're getting them back really quickly, which is really a huge benefit. There for a while, in the middle of the pandemic, there were times when it was taking 7 days, 10 days, 14 days, and that was just dreadful how long it took for a while, but we're good now.
That's good to hear. Things have caught back up. Monica, same type of thing, right? Important to know, I guess, if you're not feeling well, why you're not feeling well?
Absolutely, and I think it's important to know that senior leadership at the hospital heard our concerns and really jumped into it and said, we need rapid testing, we need a platform to do it on, how can we do it, and let's move forward. And they were able to erect this program pretty quickly. And we are able to see these patients, and if you have a cough, cold, or you have a thought of, I'm just not feeling right, come and get the test. It's a 24-hour thing. You get to see it the next day. Gives you a little bit of peace of mind. And then, two, it encourages people to understand why it's important to stay home if you have this illness. If you have signs and symptoms, why is it important to stay home? But we can also give you some answers. One of the most important things is even if you have a negative test, people need to understand that if you have a negative test, that's not a free ticket to ride. If you still have symptoms, you need to stay home. You need to protect our community and your loved ones and your family members, just in case. I mean, there's always that. The good thing is if it's positive, it is a solid positive, and we know to keep you at home, and our treatment doesn't change, but it gives us a little bit of data to go move forward with our state.
Right. Well, and it hopefully stops the spread. If you're positive and you start staying home, then that transmission has hopefully been stopped at that point.
Exactly. And that's why we encourage folks to come in and get tested. As Monica said, even if you're just having, maybe a little chills, I just don't feel right, I have a little body aches, but you don't necessarily think, I must have COVID. No, I just am not feeling right. Well, come in and get tested, because we'd rather you come in and get tested and know, and that way you can stay home, you can quarantine, rather than saying, I'm not feeling quite right, but still going around your daily activities and possibly exposing people, even though you might only have a mild or even an asymptomatic case like you mentioned.
Right,
Yeah.
right. And I think that's maybe been the most difficult thing for maybe folks who aren't medical folks to understand, is how they could still feel relatively okay and still be spreading this virus, certainly not on purpose, but just by going through their normal everyday routines. It spreads just that easily, unfortunately. It's part of the virus's unique characteristics, I guess.
Exactly, yeah. It's a very interesting and a very powerful virus. So get tested. If you're feeling unwell, get tested. And then we want everybody, symptomatic, asymptomatic, everybody across the board, to continue taking those precautions, Scott. Keep wearing your mask. Even after you've gotten vaccinated, keep wearing your mask. Keep washing your hands. Keep social distancing. This is going to be a new way of living for a while. But it's worth it. I mean, wearing the mask, washing your hands, social distancing, it's working. And the vaccines are just going to take us back to the next level of normalcy, getting back to where we were before.
Right. Well, and one of the things I think we've noticed about the precautions that we've been taking, the mask wearing, the hand washing, all those things, flu cases this winter seem to be very low, if not gone altogether, right? I'm not making that up, am I?
No, you're not. I mean, these
you're
masks
seeing
have
it.
essentially eradicated the flu. Not really, they haven't eradicated the flu, but we have seen literally almost none of it. Where we would normally be seeing 120, 130 cases a day right now, we're seeing essentially none. So mask, it's very effective.
Interesting. And so I would think that maybe in future years, that perhaps for flu season, we start wearing our masks again as a way to stay healthier. We'll see. Okay, we'll see. Very, very interesting. Well, we're just about out of time this morning, but I wanted to ask you both a little bit about your colleagues working at the hospital, working at urgent care. I think all of us are so appreciative of your efforts for being on those front lines for 12 months and counting. And just tell us, how are they doing? Are they getting to take a break? Are they able? I mean, I know they're driven by their passion for their work and to keep people healthy, but can you let us know kind of how things are going from both personally and your staffs?
Sure. I think that our numbers are finally starting to come down a little bit in San Juan County. You know, there was a point, and I know you guys have had Dr. Underwood on and Mr. Bourgeois on, and you've heard the numbers being almost double what they're supposed to be.
Some weeks there were crazy numbers.
Yeah,
they were
the
just so
numbers have
high.
just
I don't
been-
know where you put all the patients at
Right.
the hospital, but we're so grateful that they are coming down. Yes, indeed.
And so grateful to the doctors and nurses and everybody from the ground up, from administration to the clerks who are registering to housekeeping, which is just so important. I mean, critically important at this time. Of course, all the way up to the doctors and nurses. They've done a fantastic job. They're hanging in there, the whole community, including all of us, even though we're on the front line, on the outskirts in the clinics. We're all grateful to them for taking care of those patients who are emergent, who have to go into the hospital, who many of them are in there for weeks, some of them even months. Some of them are, of course, having to be intubated and on the ventilator for long term. Our hospital has done a fantastic job. Our doctors that are in the hospitalist group are just wonderful. Our ICU docs are fantastic. And, they're hanging in there, Scott. But they appreciate all the community support. Monica mentioned today all the stuff that, well, you tell them, Monica, about all the stuff folks have done for us. But they're doing the same thing for the hospital, and let it continue, folks. Like, if you're grateful to the doctors at the hospital, let them hear about it either on social media or through different acts of kindness. Tell them a little bit about what
What have you seen?
So, Scott, I was so taken back this year during this pandemic. It almost brings me to tears. The community support that we received was phenomenal. I mean, it came in forms of food, hats, masks. People were bringing us, when hand sanitizer was almost, you couldn't find it. The hospital had hand sanitizer, but people were donating hand sanitizers to us because they didn't think we had it. They were donating anything that they could and just calling with words of encouragement was just...
homemade masks, homemade scrub
absolutely
caps.
The prayers that they sent, the rocks that they would leave in our parking lot. We had thank you cards on some of our cars. They had a group of kids that came out and drew chalk drawings for us just to thank us. Our community is just amazing, absolutely amazing.
Truly. And many restaurants bringing catering lunches and stuff like that, or bringing us gift certificates. The massage place brought us over coupons for facials, and just really abundant amount of community support. And it's
Very nice.
been
Nice to hear.
Very much appreciated.
Yeah, nice to hear. Because I'm sure some of those, during some of the peak times, some of those shifts were pretty long for many of your folks, and they were asked to maybe stay late or do a double or do whatever the case may be because of the demand of the virus, and it just wasn't letting up until finally it did.
Well,
And we're knocking on wood that it's going to stay that way. The cases are low.
I think other community members picked up on it too. There was a lot of fear in our community, and there was a lot of anger, and there was a lot of diversity, and we had a lot of protesting going on, and people picked up on that, and their kindness just shined straight through. We had police officers coming in and checking on us on occasion, and we had community members that were ready to step up and volunteer just to help. It was amazing, absolutely amazing.
Great to hear. Well, and again, we are so thankful that the numbers are coming down, but again, just as quickly as they came down, they can go back up. So that's why both of you are saying continue with the mask wearing, continue with the hand washing, continue with the social distancing. Even if you've gotten the vaccine, it's just so important until we really get everybody on the same page and move out of this.
Exactly.
And don't put off your health care. We got to get back on track and get people seen for their hypertension. We got to make sure that we don't have a fallout later because people are delaying their care because of the fear of going in or thinking that there's not going to be a spot for them. That we will make that appointment for them and make sure that they're seen. Right.
And that brings us back to kind of why we started this morning, which is San Juan Health Partners Urgent Care. You all are continuing to see these patients safely on a regular basis, and you are there serving the community, right, at Urgent Care.
And Urgent Care also is able to make referrals over to Farmington Family Medicine as well now. The San Juan Regional opened up a new primary care clinic, and there's plenty of openings, and we can make that referral that day. Patients are getting in within a week and being seen and establishing health care. So it's been a wonderful experience.
That is great to hear. So someone is maybe has a health issue or a concern and they don't have a regular physician to go and see, they can come to Urgent Care.
We can be their starting point, absolutely.
And you can refer them to someone who can then maintain their health, hopefully, going forward.
Right. We're here to fill the gap. We're here to take care of you in an urgent manner. But if there is a long-term issue going on, we can facilitate the referral. We can get you into a primary care physician and get that ongoing care.
Gotcha.
But it is safe to come to urgent care. We've got everything available that we've always had. We've got medical doctors on site to take care of you. And so don't put it off any longer. If you're having any problems, any concerns, get in to see your regular doctor, come in to see us, let us help you. But don't put off your healthcare needs any longer. We're seeing too many things that have been put off, and it's going to cause more problems in the long run. So get in to see your doctor or come in and see us.
Really good point, because if you do not address these things early on, we hear all the time how, well, if you just had come into us 6 months ago,
Right.
we could have caught it, and now we can help you, but we can't necessarily help you get rid of this, whatever this is.
Right.
So, very good advice. Thank you both for coming in this morning. Thank you for the work that you're both doing for our community and at San Juan Health Partners Urgent Care. We appreciate it.
Thank you,
Thanks,
Scott.
You're very welcome. My guest this morning here on KSJE.